following Wednesday's protest of women dying in childbirth under the slogan Gambia Women Life Matter. National Assembly members took turns to address the issue on Thursday. The Minister of Health was also in Parliament to answer questions from lawmakers on the subject after a member requested his presence. Julden Jaiswari has more in this report.
Commenting on the issue, the National Assembly member for Jara East, Seni Toure, said there is need to reflect on how to upgrade the health sector. He said maternal mortality is a very serious issue and needs to be stemmed. The member for Banjul North, Usman Silla, agrees. He said it is the duty of every country to ensure that no woman dies during pregnancy or childbirth.
Every effort has to be made to ensure that maternal and child mortality is a thing of the past. Mothers deserve the attention that they require to go through their pregnancy and then end up in safe delivery with both the mother and the child being alive. That should be the quest of the government, the quest of the National Assembly, and the quest of those that are supposed to be rendering service, that are supposed to be attending women in both antenatal and postnatal conditions.
A representative of Ilyasa Dembo Kamara said nurses needs better training on handling and caring for pregnant women. But the NAM for Sani mentoring, Keba Jallo, is of the view that men are partially to blame. He said some men don't give their pregnant women nutritious food.
How many women will deliver that would need blood? Because during their pregnancy, they face malnutrition. So let us go over this and see, and start everything at home to make sure that when your wife is pregnant, you give her good food because she is feeding herself and feeding another child.
According to the latest global estimates from the United Nations, 295,000 women died in childbirth every year, or as a result of complications arising from pregnancy. This equates to about 810 women dying each day, roughly one every 2 minutes, according to the World Health Organization. The NAM for Serekunda said the future of society is put into jeopardy wherever there is a case of maternal mortality. Halifa Saleh said women need protection in order for the future generations to be protected. In response, Gambia's Minister of Health said maternal mortality is on the decline in the Gambia, despite the perception that it is on the increase.
It is important to emphasize that it is actually on the decline based on what had been happening in the previous years. The figures below corroborate these findings. In 2013, according to the Demographic Health Survey, there were 433 maternal deaths per 100,000 live births. Now, when you go to 2014, it was 208. 2015, 250 per 100,000 live births. 2016, 195. 2017, 236. 2018, 283 per 100,000 live births. 2019, 221 per 100,000 live births. And as we speak, based on the figures already gathered up to September this year, doing the calculations, it is 169 per 100,000 live births. So we can see the declining trend.
Dr. Ahmadulamin Samate said that maternal mortality is a complex issue which is caused by many factors. He said the main causes of maternal mortality in the Gambia is pregnancy-induced hypertension, bleeding, anemia, infection, malnutrition, among others. Comparing Gambia to other countries, Dr. Samate said Gambia is not doing so bad, but he was quick to add that when it comes to human life, everyone is important. Dr. Samate also agrees that attitudes of a few healthcare workers contribute to some maternal deaths sometimes. In an address to the nation last Thursday, President Adama Barrow said his government is working on better health care and is making efforts to reduce the number of babies and children dying a few days after birth or before their 5th birthday. He said his government has invested $32 million towards immunization services and that his government is also committed to reducing the high number of women dying during childbirth. For iAfrica News, I am Juldenjai Suare.